Let's discuss rather exactly how Gauteng is coping. We're joined by the province's Health MEC, Dr. Bandile Masuku. MEC Masuku, good evening and thank you so much for your time on News at Prime. Firstly, a sense of where we are in terms of the province's strategy to fight and combat COVID-19.
Good evening and good evening to your viewers. I think what we are in now, we did indicate last week that we are in the space in the middle of the storm. So our best approach when we're in the middle of the storm is to get to address every challenge as it arises, every day, every hour, every minute. And this is what we are dealing with now because we have had time to plan and the plans are already underway. And now it's just the time to make sure that we get interventions in place and be able to deal with all the challenges as they come.
What are some of the biggest challenges that you're facing right now?
You know, the bigger pressure is about our sense of bed management, which we are seeing becoming more and more a bigger problem because of the number of beds and some of the shortage of some of the critical beds. But we have been working very close with the private sector in making sure that we're able to direct patients where they're supposed to be going. And we have actually taken a stance that no patient should be actually turned away from a facility and they should be getting any form of treatment even whilst they're waiting for transfer into the hospital to get a proper bed or transfer out to another hospital to get a proper bed. And this is the work that we have been doing. And I think in the last two weeks, it's something that we have been perfecting and we are still continuing to perfect.
So when you talk about a shortage of beds, is this in the hospitals that have been set aside, and does it include some of the field hospitals that you had also built in order to accommodate patients?
Remember, the field hospitals are meant to actually be able to decant a number of patients that have been stabilized so that those who need the actual critical care, they actually stay in the hospitals. So the field hospitals have started now to be in action. They've been activated in the last 2 weeks, and we are seeing the numbers actually increasing every day. And we are also aiming to put another one, like I think we've indicated before, at Tshwane Expo, which will be ready towards the part when we are getting to the peak, which will be in the next coming 3 weeks or so.
So what happens then when beds in the private and the public sector reach full capacity? Because if I'm hearing you correctly, we're not too far off from there. And at this point, of course, there's no telling what the final number of hospitalizations will be when this disease is at its peak.
Yes, I think that's the point, and that's the reason where the field hospitals will have to come in, so that we are able to decant those who need less intensive care, who just require some continuation of clinical care, so that we remain with those who are really sick in our hospitals. So field hospitals will come in handy, and within what we have actually predicted with our modeling, I think over 3,000 beds in field hospitals will be adequate to deal with the numbers that we are seeing. And at the moment that the surge has not had those higher numbers as predicted before, and I think we are still looking at it and seeing how the behavior of the pandemic would be.
So what happens then, again, when the public health facilities and the private health facilities for especially those ICU beds that are so important, when those have reached full capacity?
So it means our field hospital will have to be escalated in that manner to make sure that they're able to give that particular critical care. And that means that most of our field hospitals will still have the capacity to be escalated to meet the need as it actually is required. But as I've said to you, that the challenge when you're in the storm is about looking at the data, looking at what intervention should be put in, and then respond timeously and rapidly to make sure that you don't get to a point where you don't get a patient having to have a bed where they actually, in the sense, need it.
Do we have enough oxygen in the province for all those that need it?
Yes, that is the affirmation that we got from the company that produces oxygen, and hence they've been doing quite a lot in providing more. that we actually required because the demand has increased. In the last 3 weeks, it has increased fourfold in most of our facilities. And in our field hospitals, we are also putting up more oxygen facilities to make sure that we are able to deal with it. So at the moment, the company that is producing has actually affirmed that they do have enough, and also they have, if there is going to be a need to redirect in the industry where they require oxygen for their production, to redirect that oxygen to medical care. So at the moment, we are still quite confident that we will be having enough. The only thing is just how to get it to the patients in terms whether we're going to use concentrated oxygen or we're going to use trunking, which meaning that we have to trunk all our beds that are requiring oxygen.
While you're working on all of this, you're dealing with staff, human resources, and those that are at the front line of this. You're dealing with nurses and doctors who are constantly falling ill and needing to be at home, whether it's for self-isolation or recovery. Speak to me about how that is affecting the system overall.
That is a big problem, and hence we are bringing quite a lot of staff in the beginning of the new month of August. We're aiming to bring over 1,500 staff in different categories who are going to help in terms of the field hospitals, that are going to help in terms of particularly introducing some new shifts where there is a need, because 2 shifts might not be enough, because we still need to refresh and make sure that our staff get time to be actually to rest. So there are a number of avenues that we are looking at, but the numbers are going to continuously increase. We are looking at over 1.5 healthcare workers by the end of this month, and towards the peak, we are still also aiming to get over 1,000. So it's something that we are continuously doing and increasing as we go.
Where will these health workers be coming from?
We have a database that we collected from our e-recruitment that we did back in April, and we're also going to use some information from some of the agencies, particularly the nursing agencies that they have. But we have realized that in our database and in the agencies that exist, there is some people that are actually a duplicate. So we are using the information that is easily available from our point and also from the agencies to make it easier for us to be able to contract them as quickly as possible.
When you look at the province's hotspots, what is the story or the picture that is emerging there? What are you learning about how this virus is spreading in the province?
The hotspots mainly that we have seen, we're actually visiting it from the visiting part of it in Johannesburg, in the area of Orange Farm for the next 4 days, where we are looking at our regulations being enforced, how people are behaving in terms of wearing masks and social distancing. And it's a matter that we are dealing with every day in terms of those who require to be isolated should be removed from the community. But the general behavior sometimes it's quite disappointing when you see people only wearing the mask because they are just afraid to be reprimanded by police, but not for their own health, which is something that is a big problem for us.
Are you finding that there are particular events or gatherings that are driving the infection rate in Gauteng, or even certain behaviors of the members of the population in Gauteng that are driving this infection rate?
Over the weekend we saw, like there was a soccer tournament somewhere in the northern suburbs, in one of the informal settlements there, which was quite disappointing. It was packed, people without masks and people just interacting freely. And the other one is just the funerals, which are continuously where people are blatantly, disregarding the regulations. And this is something that we said before, that we still, as a public, as a community, have a role to play in reducing the rate and in reducing the spread of this virus. So this enforcement still becomes a very important aspect of our work that we are doing in terms of prevention and actually stopping the spread.
All right, let's leave it there for tonight. The Gauteng Health MEC, Dr. Bandile Masuku.